Okay, so today we're going to be talking about the 4 factors of migraine. And the real goal of this talk is to allow you to understand not only what a migraine really is, because I see that there's a lot of misconception about what really a migraine is, but also what we can do non-invasively to help these conditions. Because the current medical treatments for these, they leave a lot to be desired, and what we're learning as we go through these kinds of rehab programs is that we can make a big change in migraine in a non-invasive fashion. So let's get right into it. Before we do, a little bit of an introduction as to who I am. I'm Dr. Dan Perman. I am a clinician here at Root Cause Medical Clinic. I'm also the owner and founder of Virtual Brain Rehab by Perman Chiropractic Neurology. And the purpose of Virtual Brain Rehab is to offer an online resource to give people that may not be close to a neurological rehab specialist some sort of resources. So, I create content online to teach, basic exercises and therapies that people can work on, just so that we can help more people that, might not have the ability to see somebody in person. I also do digital one-on-one consultations as well to get to that population that just isn't close to somebody who does the kinds of things that we do. Now, that said, there's nothing better than seeing somebody in person. So that's why I love being here at Root Cause, because it allows me to still see those people in person, the ones who are nearby. So I love that I'm able to kind of hit it from both ends. At the end of the day, if we want to see somebody in person, we should, just not everybody has the proximity or the resources. So that's what's going on there. Now, I'm a board-certified chiropractic neurologist. That means I am certified in various neurological rehabilitation techniques and diagnosing and working with various types of neurological conditions. Before I came to Root Cause, I ran a clinic down in Beverly Hills. I did that for a few years, but I've since moved back up here to the Bay Area just to be closer to family and to settle down a little bit. Just some of my background. In college, I worked as a research assistant at Harvard Medical School, so I spent a lot of time in the neurobiology labs. I'm just a nerd about neuroscience in every definition of the word. But I considered going into research, but I found that I really wanted to be working hands-on with people and directly with people one-on-one. So that's why I shifted towards neurological rehabilitation. And what I've really gotten specialized in over the last 6 years of my career is the migraines, concussions, and the dizziness conditions. These are conditions that are very underserved in today's population. There's not a lot that's being done rehabilitatively for these things, and there really is just so much that we can do when we get down to it. So I've spent a lot of my time focusing on how we can help these conditions non-invasively, and obviously today we're going to be talking about migraine. So let's get into it a little bit, but first, again, this is just a little picture of Root Cause Medical Clinic. This is our Saratoga location. We have 2 locations, one also in Clearwater, Florida. And this place is incredible. Ever since I've come here, it's really redefined what it means to be a practitioner. The facility is absolutely beautiful. The staff is incredible, and the practitioners are just world class. I mean, practitioners of all different backgrounds: functional medicine, physical medicine. There's just so many people that we can help in so many different ways. So very, very happy to be a part of it. Okay. Just some migraine facts before we get into what migraine really is. It's the 3rd most prevalent and 6th most debilitating illness in the world, so there's a lot of people dealing with this. In fact, about 18% of women in America, 6% of men, and 10% of children. That's about 1 in 6 Americans that are dealing with this. That's well over 50 million people that are dealing with migraine in America alone. Migraine tends to run in families. We see about 90% of migraine cases have some sort of family history, and it's so common that it's one of the first questions I'm asking you. When you sit down with me about your migraine is, does anybody else in your family get this? Because if nobody in your family gets it, it's less likely that you are actually experiencing migraine. And migraine is, I found, also very misdiagnosed. Sometimes people think they might have migraine when they really don't have migraine. So a big part of working with us is figuring out, okay, one, is this migraine or not? Because if it's not migraine, the treatment might be very, very different than if this really is migraine. So an important distinction to make in the family history is one way that kind of points us to that. As far as the effect of migraine economically, it costs us about $36 billion a year in healthcare costs and lost production and work, migraine alone. So there is a huge opportunity for us to help these people so that they're not having to be so reliant on the treatment options that they've been experiencing up to this point, and also just helping them be more productive in everyday life, both in their careers and also in their personal life as well. So we have a lot of work to do there. Okay, let's get into what migraine really is. Now, I want to be very clear. I didn't make any of this up. None of the definitions or information about migraine that we're going to talk about today, about what it is at least, I came up with. I didn't come up with any of it. Almost all of the information regarding migraine we're going to discuss today comes from this scientist down here, Dr. Peter Goadsby. Dr. Goadsby is one of the leading, if not the leading, headache researcher in the world, and he published this exhaustive, incredible research paper called The Pathophysiology of Migraine that outlines almost everything that we know about migraine to this point. And this quote here is from his 2012 version of the paper. He has since updated it with even more information. If you are a scientifically minded person, I would highly recommend that you dig into this paper because it is just such a wealth of knowledge. But I'll try to boil everything down into much simpler terms for us today. Okay, so migraine. It's an inherited episodic disorder involving sensory sensitivity. Let's just start with that. So what this basically means is inherited. So most of the time it comes from somebody in your family. It's genetic. And it's episodic, meaning it comes in episodes. Now that varies depending on the severity of the condition. Some people have an episode, once every 10 years. Some every single day is an episode. And that goes down to, how sensitive your brain is, how bad the migraine is, and we're going to get to dig a little bit more into that as well. It's likely to be a brain disorder involving altered regulation of control afferents. So what this means is that migraine is a neurological condition, okay? It has to do with the way that your brain is regulating itself. There are issues in migraine patients with the way that the brain controls the vital signs, regulates the vital signs, and when this doesn't do so well, it leads to that sensitivity that we're talking about, and that leads to your migraine. And we will learn a little bit that a migraine is much more than just the traditional symptom that we know a migraine to be, which is that stabbing head pain. All right. Migraine is a highly disabling state, and it is a functional problem, meaning it leaves no anatomic trace, although, it can really ruin somebody's life. And the thing to take away from this is that we cannot see the migraine. We know that this is an issue with brain sensitivity. We know that there are regions of brain cells that are fatiguing, and when they fatigue, you get your migraine, but we aren't able to point on an MRI to say, okay, that's exactly where your migraine is. The technology is just not good enough, and it might never be good enough because this is firmly defined as a functional issue. It's an issue with what I call the software of the brain. It's not like there's a stroke or a tumor or anything like that that's causing this. This is just a genetic neurological issue that manifests as sensitivity in your brain. So that's why we can't rely on imaging to diagnose these kinds of things. Oftentimes we have to rely on your history, but also an in-depth examination to try to figure out, okay, where is this coming from and what might we be able to do to get this better. Okay, so what causes migraine? It's a complex neurological disorder that causes misperception of pain or sensation. So as I just touched on briefly, and I gotta hammer this in, it's a genetic neurological condition where pools of brain cells in various different areas are just genetically weak and they fatigue easily. And when a brain cell fatigues or gets tired, it becomes extra sensitive and it starts, firing off like crazy. So this is really what happens with a migraine. A part of your brain fatigues, and that causes that area to go haywire a little bit, which leads to the pain that you might experience, the dizziness you might experience, the light sensitivity, sound sensitivity, all that kind of stuff. Now, initially, we thought that migraine was purely a vascular or blood vessel issue. We don't think that anymore because that's not just exactly what's going on. After that, we thought it was a neuromuscular issue or a problem with the brain's control of the muscles. Now we know that it's just much, much more complex than that. So we label it as simply neurological, because when the brain is having trouble regulating its vital signs, a plethora of things can come about. Yes, blood vessels can constrict, which leads to that throbbing, stabbing pain in your head. Sometimes that causes the muscles to spasm up on you, which leads to, that extra neck tension and that neck pain, or sometimes back pain as well. Sometimes it leads to fatigue of the sensation nerves that leads to numbness and tingling and things like that too. So there's just so many things at play here that we simply are labeling migraine as neurological at this point. And the primary area that the brain that's affected in the brain with migraine is what's called the autonomic system. And the autonomic system is our vital signs. So regulating blood pressure and heart rate and oxygen and the size of your blood vessels and things like that. We're seeing that most of the symptoms of migraine come about because the brain is having trouble regulating these vital signs. Now, the challenging part is there's multiple areas of the brain, usually in the brainstem and the cerebellum, that are involved in controlling the vital signs. So when we're talking about rehabilitation for migraines, we want to target just the spot of the brain that we want to work on. Now, as I had just said, we can't look at an MRI and show exactly what part of the brain is affected. So we have to rely on an exam that tests different functions of your brain to see, can we get more specific as to which area of the brain's not doing its job well? And from there, can we design a therapy plan to rehabilitate, strengthen those areas of the brain as much as possible to get them better? Okay, one thing that we have to get very, very clear on before we move on is that a migraine is not a headache. People think that a migraine is a headache, and that's understandable why they would think that, but that is very far from the truth. The headache that we feel as a result of migraine is a symptom of the migraine. It's what we call a migraine-type headache. And that's just a symptom. There are many people with migraine that don't experience any head pain at all. For instance, people with vestibular migraine might only get dizzy or get vertigo when they have a migraine. People with hemiplegic migraine might feel like they're having a stroke. They go droopy on one side of their face, they go tingly and numb on one side of the body. So migraine is the cause of those symptoms, but the headache itself is not the migraine. It's a symptom that comes about as a result of the brain fatiguing, which leads to those headaches. So that's a very big distinction for us to have here. When you're saying I'm having a migraine, you're not saying I have a headache. You're saying my brain is fatiguing and that's leading to my headache, okay? Okay, so onto the 4 factors of migraine. The first and almost arguably most important factor is this autonomic dysfunction, okay? This issue with the nervous system, this neurological control of your brain. This is the overarching cause. Now, why that's happening, we're still learning a lot about that. We know there's likely a genetic component to this. But at the end of the day, for some reason, there's an issue with your brain's ability to control these vital signs, and that's what leads to all the types of migraine symptoms that we can experience. But that's not the only important thing here. We also need to look at what's called the triggers. So there are various triggers in our body that are going to make us more likely to experience a migraine. And there's 3 main triggers. The first is hormonal or stress related, the second is nutrition, and then the third is musculoskeletal. So today what we're going to dig in when we're talking about rehabilitating and actually making a change with migraine non-invasively is how can we affect this autonomic dysfunction, and then how can we reduce hormonal stress, nutritional stress, and musculoskeletal stress as much as possible to make us as least likely to have a migraine. Because at the end of the day, there really is no cure for this, but there is a spectrum. You know, people getting migraines once every decade, people getting migraines every single day. Our job as your specialist is to shift you down that spectrum as much as possible so that we can make your brain as strong as possible, empty out all those stressors, and make you just far, far, far less likely to experience those migraines. One of the ways that I like to explain what a migraine is by comparing your migraine to a bucket. Now, let's imagine that the weak brain area is like a bucket, and that bucket is going to fill up with stressors. It fills up with the musculoskeletal stress, the hormonal stress, the nutritional stress, and when it overflows your bucket, that's when you get your migraine. So that's why non-invasive migraine treatment is multifaceted, because we need to make sure we are addressing the triggers, but also addressing the size of that bucket. So, you know, let's say that your bucket is very full, so we do a ton of hormonal work with you, nutritional work, musculoskeletal work. We might empty that bucket and you might start feeling a bit better, but we're not really attacking that underlying neurological issue, which is the physical bucket. So that's not to say we don't want to address your triggers. We really do want to address your triggers, and we're fantastic at doing that here between the functional medicine team and the physical medicine team. But what we also want to do is give you exercises and therapies to make your brain bucket bigger, so that you can handle more of those stressors and then be far less likely to have a migraine. Because we don't want you to walk on eggshells if possible. You know, some people do need to, you know, really change their lifestyle to manage these conditions, but we want to stress you out as little as possible when it comes to that. So by also teaching you neurological therapies to make those brain regions, that weak brain area, as strong as possible, that allows us to just make you way, way, way less likely to have a migraine. So that's one of the best things about working here at Root Cause, is we're really able to hit this from every single angle. Through the work that I do, I'm able to help diagnose where in your brain is this going wrong and what can I do to make it better. At the same time, the physical medicine team can work out those muscles and joints and teach you physical exercises to work on as well, where the functional medicine team can really dig into the nutrition and the hormonal side of things. So really an unmatched service. Let's go a little bit more into the neurological rehab part of this though. So through the work that you do with me, my aim is to make that brain bucket bigger. We're trying to get that brain as strong as possible. And the way that we do that is by applying various neurological therapies. I'll just run through a couple of the therapies that are on the slide here, but there are so many things that I can do to challenge your brain and strengthen your brain. So we do a lot of work with working eye movements. The movement of the eyes is right around where those vital signs are regulated in your brain stems. So by exercising your eyes, we're able to help heal that part of the brain a little bit. So things like gaze stability exercises, where we work on focusing on targets and moving your head around them. Sometimes different kinds of eye motion exercises, tracking targets in and out, up and down. But also some electrical stimulation as well. We do something called RPSS, which is a nerve stimulation to the face, which just strengthens those nerves in the face to, you know, make it less likely to have that pain in the face. But also we do electrical vagus nerve stimulation. And if you've worked with Root Cause at all before, you know how important it is to strengthen and regulate your vagus nerve, which is your rest and digest nerve, your recovery nerve. So there are many techniques that you can do at home to exercise this, but when you're working with me, I have an electrical stimulator that I use. I clip it to your ear and your neck, and we electrify it. You know, we stimulate it electrically to try to get it to fire off. So with all of this combined with, you know, all the work you would do with the physical medicine and the functional medicine side of things, we just give you the best chances at seeing improvement here. Okay, let's dig into the triggers, because it's really important that we focus on those too. Let's start with the nutritional stuff. Now, I'm going to do a broad brush through the nutritional recommendations for migraine. The functional medicine team is much more equipped to dig into this with you in person, but I'll give you the basics. We know that inflammation is heavily involved in migraine. And when we're talking inflammation, most of the time there's food sensitivities involved with that. There might be, intestinal permeability that might be a component in that. There might be a parasitic component to that. So there's a lot that you need to dig into with the functional medicine team to figure out exactly why you might be inflamed and whether or not this is contributing to your migraines. Some common foods that have been shown to inflame our gut with migraine are glutens, dairies, caffeines, and alcohol. Those are the most researched, but there's some other ones that have been shown to maybe affect, sometimes citrus fruits, chocolates, sometimes eggs, cured meats, those kinds of things too. So, there's no one size fits all for this. You really do need to work with somebody to figure out what your sensitivities are, what you can and can't handle, what might be best for you there. And then one more thing that's super important nutritionally for migraine patients is blood sugar regulation. Migraine does not like big spikes in blood sugar and big dips in blood sugar. So what that means is you have to be keeping a nice steady level blood sugar throughout the day to give you the best chances of avoiding migraine. And that means snacking regularly, avoiding giant meals. Again, that might not be appropriate for everybody, so please do work with the functional medicine team to see if that's the right way for you to go. But most of the time we really want to try to just keep that blood sugar as even as we can all day long, so that we're not stressing your brain out too much. Okay, I get a lot of questions about caffeine because you'll notice if you're a migraine patient that a lot of your medications have caffeine in them. And that's because caffeine in the short term helps migraine. In the long term, it perpetuates it and it makes it worse. And the reason why caffeine tends to help is it is what's called a vasodilator. So it makes the blood vessels relaxed. And part of the reason why we get those pounding headaches with migraine is because the brain causes those blood vessels to spasm or constrict on us, which limits blood flow. So that leads to a lot of pressure and pain. The caffeine helps relieve that. However, because caffeine is a drug, the brain can become dependent on that over time, and we really don't want that to happen. So caffeine, in a pinch, yes, it might be something that's helpful, but it's not something that you want to rely on when it comes to migraine management because you start to become dependent on it, and that's not great. I have helped many people eliminate caffeine from their diet. It's not as hard as you think it would be, but it just takes a little bit of coaching, so happy to help anybody through that. Now, the most researched diets for migraine management is the ketogenic diet and the vegan diet. But again, there really is no one size fits all for this. So you really do want to work with some sort of nutritional specialist to really hammer in what types of food should I be eating, what's the best diet for me. Okay, let's go on to the musculoskeletal trigger. So there's a lot of research at this point on different types of musculoskeletal therapies and them helping with migraine. So, here's one where acupuncture has been shown to help almost as much as drugs, if not more than drugs. Chiropractic adjustments have been shown to be effective with treating these kinds of things. Upper cervical specific chiropractic, where they just focus on the top bones in the neck, has shown to be effective for these kinds of things. Electrical and magnetic stimulation to the muscles has been shown to really help with these kinds of things. Even massage has been shown to help a lot with these kinds of things. So basically, at the end of the day, all of these types of musculoskeletal therapies can be effective. You just got to find what works best for you. And sometimes it's a combination of things. Sometimes it's one that really works better than the rest. But find what you like, basically. You got to play around. Some people only respond to acupuncture, don't respond to the massage. You need to try different therapies. So if you tried chiropractic and it didn't work for you, maybe try some physical therapy, maybe try some muscle work, maybe try some acupuncture, something like that. Oftentimes there is one type of treatment that works well for you if you have a musculoskeletal trigger. Sometimes people don't have that big of a musculoskeletal component, and that's when you get into these arguments. It's like, I went to my chiropractor and they cured my migraine, or I changed my nutrition and it cured my migraine, or I did some hormone replacement and it cured my migraine. None of those are really curing your migraine. It's just those happen to be your main triggers. So when you address those, you got better. Okay. All right, let's go into the hormonal and the stress part. Now, we're never going to be able to get away from stress, but there's many things that we can do to try to manage it, and that's really important for migraine patients because we know that stressful jobs makes us much more likely to experience a migraine. And the majority of patients that experience migraines report that some sort of stress is a factor in whether or not they are going to get a migraine. Now, moving on to the more hormonal side of things, only about 3% of migraine is what we call a menstrual migraine, but a menstrual migraine is a very specific kind of migraine where it only affects you around your menstrual period. That's it. However, close to half, maybe more, of women that experience migraine will notice some kind of flaring of their symptoms around their menstrual period. So even though those patients might not have what we define as menstrual migraine, there is still a hormonal component to this. And I see it in most migraine cases, especially the female cases, there is some kind of hormonal component. Now, there's a lot that we can do for this non-invasively. And we will go into that, just a little bit. It's actually quite simple. Not really simple, but it's a little bit less complicated than what you're seeing on the screen right now. Basically, this is a layout of all of your hormones, but not only the hormones, what leads to hormones, what helps build your hormones up, what helps break them down. If you're low in estrogen, great. The real important thing to figure out is, why are you low in estrogen? Are you not making enough of it? Are you breaking it down too quickly? Where is the issue here? From there, what we can do is give you, supplements or tools that can start to balance that out so your body starts making things the right way. Hormone replacement is not always the best way to deal with the hormonal side of migraines. Sometimes it's just about getting your internal environment regulating appropriately, and then your brain starts making things the way that they're supposed to make them. So please work with your functional medicine practitioner to get a handle on this. It's something that's relatively easy to manage. We just need to do some very specialized testing to get a picture as to exactly how we should rehabilitate this with you. Okay, let's talk about the current prevention for migraine. The large majority of the current traditional treatment for migraine involves some kind of medication, and then also, in some cases, surgery. Now, here's the thing about migraine medication. Up until about 2 years ago, there weren't any real medications that were designed specifically for migraine. All of the migraine medications that are being prescribed had other uses, but have been shown to help with migraine sometimes, so they've been prescribed to migraine patients. Now, in the last 2 years, there have been a couple of migraine medications that have come out that are attacking, the neurological component of migraine a little better. And don't get me wrong, they are much better options than some of these other ones. But if we can really get to the bottom of this and strengthen your brain as much as possible, that's a much better outcome for us. We'd much rather make your brain and your body as strong as possible naturally, so that you have to rely as little on the medication as possible. Now, the surgery that they'll oftentimes do for this is what's called a nerve ablation surgery. Well, they'll actually kill off some of the nerves in the face so that you're not aware of the pain that you're experiencing. That is a last-ditch effort. We really don't want to do that if we can avoid it. But that's just the current model right now, and it's really not doing that great of a job, and that's why I'm so passionate about this. There are so many things that we can do non-invasively to help with these things, so you don't have to rely on the medication, so you don't have to get that surgery. It is more than worth giving that a try before we go into the more invasive options. So let's just recap here real quick. The cause of migraine is this brain autonomic dysfunction, an issue with the brain's ability to regulate your vital signs. But there are these triggers that are going to make us more likely to have a migraine. They're going to fill our brain bucket up. Those triggers are stress and hormonal imbalance, nutritional stress, and musculoskeletal stress or dysfunction. So luckily here at Root Cause, we're able to hit every single aspect of that. And that's why we get fantastic results with these kinds of things. there is hope. Okay, a lot of people kind of give up on this, and even if you are experiencing a migraine every single day and you have been for years and years and years, there may be something that can be done for you. It just takes a little bit more detective work to figure out exactly where this is coming from and exactly what types of therapies and treatments you might respond best to, and then from there it's just about hard work on your part. Rehabilitation takes time and effort, so you have to be willing to put a little bit of time into yourself every single day to make sure that you are eating the right thing, taking the right supplements, getting the work done on your body, and also doing your musculoskeletal therapies, doing your neurological therapies to make that brain bucket bigger and really strengthen your brain. If you have any questions or concerns, or you just want to learn a little bit more about what's going on with your brain, please contact us. These are conditions that we're highly experienced in treating at this point, and I know that I personally am happy to chat with anybody who has more questions about this. I love nothing more than helping people, so it would be an honor to chat with you and see if I can help you. Again, my name is Dr. Dan Perman, and I hope you learned something today. Have a great day.